All right, hello and welcome back to Chapter 8 in Computers in Healthcare. We're picking up on page 134 and we're going to pick up with our Radiology Information System. So a Radiology Information System, or you'll hear it called a RIS, is used to collect, store, and provide information on radiological tests such as X-rays, ultrasound, magnetic resonance imaging, or MRI, computed tomography, or your CTs, and position emission tomography, which is your PET scans. The RIS also supports other radiological procedures performed in radiology, such as ultrasound-guided biopsies and upper and lower gastrointestinal series. A RIS is designed to assist the technician by identifying the steps required to prepare for each test or procedure. The RIS can also assist the technician with taking X-rays and other radiological examinations by controlling radiation exposure, positioning of the patient, and image quality. Ultimately, the RIS provides patients with follow-up instructions to take home after a procedure. The RIS can also be used to assist in the management of the radiology department as well as document patient care. And a RIS can perform many administrative tasks, including scheduling patient exams and procedures, report charges to the financial information system, generate management reports, generate radiology reports, track nuclear materials, transcribe documents, retrieve test results, fax radiology results to the ordering physician, and monitor supply inventory. A RIS frequently has a picture archival communication system called PACS, and a PACS is an integrated information system that obtains, stores, retrieves, and displays digital images. In a PACS, X-ray films, MRIs, mammograms, and other radiological examinations, such as cardiac catheterization films and ultrasounds, are stored digitally, thus eliminating the need to store and manage the physical film. The digital image is immediately available for patient care, which is especially important in emergency department or intensive care situations. The ability to view radiology images from any location by the radiologist and other users is called teleradiology. The images can even be viewed at multiple locations at the same time. A radiologist can read images from home in the middle of the night, from another city, or even from other countries. Teleradiology is used frequently for consultations between radiologists who are in distant locations. All right, and so we are moving on to our next system, which is our laboratory information system. This system collects, stores, and manages laboratory tests and their respective results. The LIS can speed up access to test results through improved efficiency from various locations, including anywhere in the hospital, the physician's offices, or even the clinician's home. The LIS has the necessary functionality to be used in all areas of the lab, including blood chemistry, blood banks, microbiology, virology, and pathology. Currently, LISs involve many interfaces because they are still typically standalone information systems, separate from the EHR. It is important for these interfaces to work seamlessly with a specified EHR system to ensure integration with the clinical and communication needs of the healthcare facility. The physician order for a laboratory test is generally received from a CPOE or other order entry system. The CPOE identifies what test needs to be run, schedules them, and creates a list that indicates where the patient is located and if the test is routine or urgent. Test results can be entered into the list manually or collected automatically from the instruments running the test. The list can also print out various laboratory reports needed, such as all of the tests performed on a single day or during a patient's entire hospitalization. Other functions include, our slide has printing out our specimen labels and then notifying the lab results of panic values, which could be either your low or high, and they call those your critical results. And then picking up in the book, you have identifying normal ranges for laboratory tests, generating laboratory reports, making laboratory values as high or low or panic. So really they just kind of put these out of order. Notifying laboratory staff and physicians of panic, very high or low values via alerts, such as an audible ping or alarm, results highlighted in a different color, or a note sent to the to-do list. Printing barcode labels to track specimens, recording quality control activities, generating management reports, generating laboratory reports, and submitting charges to financial information systems. So we got a lot of different ones here. The book's not necessarily following quite along with PowerPoint, but be sure to read both sections. All right, so we're going to move on over into our next section, talking about nursing information systems. Nursing information system assists in the planning and monitoring of overall patient care. A NIS will document the nursing care provided to a patient. Clinical documentation is any manual or electronic notation of recording made by a physician or other healthcare clinician related to a patient's medical condition or treatment. There may be many different NISs available for the emergency department, intensive care areas, and other nursing areas because of the different needs of each specialization. Conveniences such as efficient and quality documentation practices, as well as easy access to quick reference guides, are important. And advantages to our nursing information systems are reduction in cost of providing nursing care, improved patient care, immediate access to information on services rendered by the nursing staff, immediate notification of results from lab, radiology, or other ancillary departments, reduction in lost charges, a reduced length of stay, and submitting charges to the financial information system. The nurse plans the patient's nursing care needs based on this protocol. Nursing documentation traditionally includes admission assessment, nursing activities, intake and output, graphic information, activities of daily living, nursing care plans, nurses' notes, and the MAR, the Medication Administration Record. The nursing information system also assists in the administrative management of daily operations of the nursing department by monitoring staffing allocation, scheduling the nursing staff, and generating performance improvement reports. All right, moving on to our next system, which is going to be the pharmacy system. A pharmacy information system assists providers in ordering, allocating, and administering medication. With a focus on patient safety issues, especially medication errors, the PIS is a key tool in providing optimal patient care. The PIS stores the patient's demographic information, allergies, medication history, diagnoses, laboratory results, and other key information. Data contained within the hospital information system and the functions of the PIS help providers reduce medication errors by using the hospital information system, the EHR, and the PIS combined with information from medical databases and drug formularies. Dropping down to the bottom of that page. PISs check for drug interactions, food and drug interactions, and other contraindications. When problems are identified, the PIS alerts the pharmacist or end user. It should also determine whether or not the dosage and administration method is appropriate for the size and age of the patient. The PIS can also manage the inventory of drugs in the pharmacy. This includes ordering drugs, inventory control, managing the formulary, tracking the cost of drugs, and reporting on the usage of controlled medications. PISs can assist in the dispensing of medications in the pharmacy, which can help the nursing units in a number of ways. Creates individual dosages, the use of secure storage systems, robotics, secure access to medications, documentation of medications administered, including when and by whom, and barcodes. All right, we have a few paragraphs here on our next few systems. So first is going to be interdisciplinary charting system. This can be used by any healthcare professional to collect and store patient assessments, progress notes, and care plans. Examples of these professionals include physicians, nurses, physical therapists, respiratory therapists, pharmacists, dietitians, and the like. The information system can also collect data such as vital signs and input and output automatically. Handheld devices such as tablets are frequently used to allow for documentation at the bedside. Our next system is the emergency department system. It is designed to meet the unique needs of the emergency department, including tracking patients from triage to discharge. The EIS is also able to record test results and other clinical information. Demographic information is obtained from the hospital information system, and the emergency department system can also assist in the department's workflow and generate management reports such as turnaround times, patient wait times, and more. This information system has become increasingly important in population health reporting. There is a need to notify state health authorities regarding diagnoses of newly emerging diseases such as Zika virus infection or multi-drug resistant tuberculosis, injuries due to mass casualty events such as terrorist bombings or train derailments, and injuries due to natural disasters such as tornadoes and hurricanes. All right, then we have our anesthesia information system. This collects information on preoperative, operative, and postoperative anesthesia-related clinical information. This system allows the patient or follows the patient through the surgical process. The information system collects information on risk factors, vital signs, types of anesthesia, anesthetic agents used, dosage of anesthetic agents, and much more. The information system uses the information that is captured to create charges for billing purposes. All right, and then we have our patient monitoring systems. These automatically collect and store patient data from various information systems used in healthcare. Data collection includes fetal monitoring, vital signs, and oxygen saturation rates. Patient monitoring systems are typically utilized in the intensive care units and other specialty areas such as the operating and recovery rooms. A patient monitoring system must be able to capture the desired data automatically. The nurse or other user should be able to monitor a patient's condition from the nursing unit, physician office, or other remote location if necessary. This may require the use of internet access to the information system. A nurse or other user must be able to create notes if needed to document and report variations in results, such as if the fetal monitor slipped out of position. Vital signs and other data collected must also be reviewed and approved by the user regularly to ensure the proper functioning of the system. All right, and next we have telehealth over on page 139. So there's two aspects of telehealth. Telehealth is professional services given to a patient through an interactive telecommunication systems by a practitioner at a distant site. And it's a telecommunication system that links healthcare facilities and patients from diverse geographic locations and transmits text and images for medical consultation and treatment. So some of our benefits of telehealth. This is number one. Improved access to healthcare, such as specialty consultations, biomedical monitoring, and second opinions. So if you live out in rural Mississippi, but you can go to a local physician's clinic, you may be able to speak to a physician here or a physician at UMC or any other specialty that has telemedicine and not have to drive 3, 4, 5, 6 hours to get that care. So it's just improves access. Second, improved continuity of care, patient education, and timely treatment. Follow-up visits for chronically ill patients, reduce travel time for all involved, and increase care to underserved areas. So that kind of goes along with that first one. Third, cost efficiency. Managing chronically ill patients more effectively decreases admissions and shortens the length of stay. Number 4, improved access to health records and patient information with online health information available for learning, peer support groups, and research information. And last, improved training and education for medical and clinical personnel as well as patients, clinical trial research, improved interactions with medical personnel for disease management. So those are all of our benefits of telehealth. Then we get drop down a little bit and talk about telesurgery. So telehealth is a very sophisticated technology. Technology used includes virtual reality and robotics, which may be used to assist with the examination or treatment of a patient. The use of robotics to perform surgery is called telesurgery. This allows surgery to be performed on a patient in a different location. Not sure I'm very interested in that aspect of technology myself. But issues that healthcare facilities need to consider when developing or using telemedicine, a subset of telehealth that focuses on the provision of care, whereas telehealth includes administrative uses and education. So we have to focus on privacy, confidentiality, and security. So you want to safeguard the patient's privacy, Make sure your network is secure among all of your different providers, whether they're clinics, hospitals, different practitioners. And then contract specialties such as radiology and mental health with private networks with point-to-point connections. Then, liability is usually shared between referring provider and the consulting provider. But for telemedicine vendors and technical staff, there is no legal precedent yet. Licensure and accreditation rules differ by states for both licensure and accreditation, so there's no federal legislation for telemedicine at this time. Then there's fraud. Vendor services, billing for healthcare services provided, and contracts need to be legal, need clear legal analysis. Policies and procedures must be developed and agreed to by all parties. Documentation requirement for patient information and services is provided. So these are some telehealth issues. All right, and our last thing to discuss in this chapter is the smart card. A smart card is a plastic card similar in appearance to a credit card with a computer chip embedded in it. Smart cards have been widely adopted for use in banking, retail, government, and other applications. 3 uses of smart cards in healthcare are emergency treatment, reducing fraud and abuse, and reducing administrative cost. Smart cards enable portable storage of health and insurance information. They are relatively inexpensive and are able to protect the information stored within them from unauthorized access. In an emergency situation, smart cards can provide a physician with the critical information needed for proper care and treatment of a patient, such as allergies, significant conditions like diabetes, and more. There are 2 categories of smart cards: contact and contactless. The contact smart cards require a scanner through which the card is scanned in order to read it, and the contactless card only has to be close to the scanner. Although smart cards are useful tools, the patient must manage and maintain the accuracy of information on the card. Some smart cards require a password or other personal identification number that the patient must remember for access. Another concern is privacy of the information on the card in the event that it is stolen. All right, and so our last little section here, impact of these clinical information systems on HIM. So the HIM professional is typically not a direct user of these various CISs, the clinical information systems that we discussed in this chapter. Although the HIM professional accesses the information through either the CIS or the EHR. However, the HIM professional is the expert on management of health records, and input from this individual is important to ensure that accreditation, regulatory, and other requirements are met. The same is true for privacy and security issues. HIM professionals are highly recommended to be part of the information system implementation team to ensure that all HIM-related concerns, such as quality documentation, confidentiality practices, and retention schedules, are addressed up front. As each CIS submits charges to the financial information system, the HIM professional may be involved in developing the charges, similar to the involvement in the facility's charge master. Lastly, remember that every clinical information system can populate the EHR with information that is ultimately managed and maintained by HIM professionals. So again, we didn't cover every section of this chapter in each one of these systems, so be sure that you read the entire chapter, be familiar with each of these systems and what they do, and happy reading and happy studying of Chapter 8.